Welcome back to 10 Minute Takes. My name's Hannah Gallacher and I'm here today with Sharon Harrison, who is the NMAHP Education and Development Lead for post-registration and SIM and Technology Enhanced Learning here at the Academy. Hi Sharon.
Hi, thanks for having me.
Oh, you're welcome. Thanks for coming. So Sharon, would you introduce yourself and explain a little bit about your role, please?
So as you said, I'm the Education and Development Lead for post-registration under the NMAHP umbrella. So that's nursing, midwifery and allied health professionals. Within my portfolio, I am fortunate enough to line manage the practice development team. They do a lot of quality improvement work within the trust. The resuscitation team, who lead all of our training when it comes to resuscitation. I have Jess, who is a clinical lecturer based here at the Academy and is leading on the BSc professional pathway, which is the top-up degree. Yes. And then I also line manage Paula Darkin, who's the Mouthcare Matters lead.
Brilliant, and I hope to get her on in the future as well, because Paula has some great things to say. So I always like to start off with asking people a really interesting question. What is the most valuable lesson you've learned as an educator that you wish maybe you knew a little bit sooner?
There's lots. I think if I was to have to pick one, it would definitely be, previously I had a focus on education with information and content that I wanted to deliver to the learners.
Okay.
And I probably didn't consider the learners as much as I should have at the very start of my career process down education. There's definitely more of a focus now on how we deliver, the pace, the mode, the place that we deliver it. You know, we're in the immersive suite now, and that, you know, focuses and leads on to our use of technologies in learning. But I think before it was very much content rather than learner engagement and what their needs were, what their learning styles were. And I've shifted massively into the design and delivery is absolutely a focus on the learner rather than what information I need them to absorb, really.
And do you think that'll translate through what Jess is doing on the top-up?
I think absolutely, we're quite aligned, and that's what I really like about Jess's educational approach. She's prioritises the learner at the forefront of everything that she does, and I think our whole team do, and I think that's the ethos of the Academy, really. It's prioritising our workforce, but looking at their educational needs and how can we train and educate them based on what their actual needs are, you know, that clinical environment as well, and how do we meet them.
So, as the TEL lead, and TEL stands for Technology Enhanced Learning, doesn't it?
Yep.
Just in case. How do we incorporate that into clinical teaching and learning?
What I really like about technology enhanced learning is how innovative it is. It's still probably quite new, and if everybody, even NHS England, were honest, we're all still learning a lot about what our capabilities are. Yeah. And day in, day out, we learn something new. I think it transforms education and really, again, puts the learner at the forefront of what we're doing. There's that safe environment that you can, excuse me, replicate clinical areas where the staff can come into a ward area with the mannequins and in a safe environment learn or try things which you don't want them to be doing on real patients in the hospital. So I think for me it's about pushing the boundaries when it comes to TEL. How can we make it as interactive and engaging as possible? So you can see we're in the immersive room now, and some of the activities on the walls, therefore, this is an escape room type thing. So the staff can come in and they've got to do the drug calculations, and they can't leave until they follow every process.
Oh, that's why the doors are locked.
So that, you know, they have to follow each step, but it's interactive. They touch the walls, the calculator's interactive, and, you know, it's how can we make that learner experience, rather than just sitting in a classroom with death by PowerPoint, how can we change that? But equally, an NMAHP approach, so this is a prescribing environment. We have the physiotherapy team wanting to come in and think about how they can transform this for their patients. We've got the maternity team are already have delivered on site, you know, and utilising the services as well. And
ODPs,
SCBU, yeah, theatre. We replicate. We've taken pictures of one of our theatres and we've replicated that, and it's just so exciting.
Yeah.
But they're using environments that are familiar to them as well, so that learning will be more improved and hopefully a deeper level.
Brilliant, thank you. Have you ever really been able to see the kind of tangible benefits of the education that you've delivered in patient outcomes?
Yeah, so one of the things that my team and I focus on is deteriorating patient education.
Okay.
I think when it comes to what we've done previously, there's lots of courses out there which are fantastic and utilised by different organisations, but they're quite specific in their design and delivery. What we've done is we've developed a deteriorating patient education course which is very Northumbria NHS specific.
And it's delivered here, isn't it?
Yeah, it's delivered at the academy.
Brilliant.
We're using the technology that we've got available and incorporating it in the day. So we set this room up to be replicate a ward environment with a patient in the middle and
a mannequin, or?
A mannequin, yeah. But we do use, you know, we do use real patients. They support the learning. We've got PC Pies that can come in, so they're the patient, carer and public involvement volunteers that come in.
Yeah.
So, but the deteriorating patient education has, you know, transformed the way that they practice safely in the clinical environment. It's about recognising someone's sick, but equally then what do I do with that information? How do I communicate it? How do I escalate it? And our model of care at Northumbria with our emergency care hospital at Cramlington and then our base sites such as Alnwick, Berwick, Wansbeck, Hexham, we need to transfer patients, and there's something within our education how we prepare staff for that and ensure that they're meeting the needs of the patient at the forefront of when they're at their sickest. So the programme really focuses on that, and I think it has made a difference already to patient care and the confidence of staff, because that's really important, that they have the confidence when they're in a critical situation where pressures, you know, mounting and they have to think on their feet, that they've got the confidence and the knowledge and the skills to look after those patients.
And they've tried that out in this kind of safe scenario where it's all very supportive and reflective, and
that's key. They need to feel comfortable in the delivery of the education that we do, and they laugh because they start the day really quiet, and we keep going, it's quite an interactive day, and by the end of it they're throwing their arms around us, hugging us and thanking us because they've learnt so much. So
and who's that course aimed at?
It's predominantly healthcare support workers and nursing staff in the hospital setting. Community do have their own deteriorating patient education. We are currently developing an allied health professional one as well. Brilliant. And then our ambition is to then focus on our non-clinical staff, so the admin staff, ward clerks, domestic staff and porters, because they'll be encountering sick patients. Absolutely, and it's about empowering them when they come across that patient. What can they do and what do they need to do?
That sounds really, really useful.
Yeah, hopefully it'll impact positively on our patients.
And we'll put the links below for people to find out how they can get onto that. Thank you. I think as this is 10-minute takes, I feel like that's your 10-minute take. I'd like to sum up by asking you what your favourite thing to teach is.
I think it is the deteriorating patient, and I think it's when we're doing simulation. But now that we've got all these technologies, I may lose the opportunity to do my role play.
Right, okay.
I get into character quite well.
You are quite the actress.
Yeah, I enjoy that, and it surprises people. I even make the noise of the BP machine.
Brilliant.
With them, a little do-do-do-do-do, and it gives everyone a little chuckle. But yeah, I really enjoy, you know, making it as real as possible
Yeah.
and interactive as possible. So if I have to get into character,
Yes.
I will.
I agree, actually. I did some role play with the trainee nurse and associates where I was a patient, and actually really got into that as well. But it was a really great way to practice that.
And I think all of our educators are having so much fun making education better for our learners, and it's an enjoyable process, and hopefully the staff are getting the benefits from it too.
Absolutely. Well, thank you.
No worries, thanks for having me.
Brilliant.